Hello and welcome to Keeping It 100 Coalition Conversations, the official podcast for the National Coalition of 100 Black Women, Metropolitan Baton Rouge chapter. I'm your host, Shanice Lewis, and on today's episode, we're shining a spotlight on the Health Committee and their impactful work in the community. We'll be discussing two of our upcoming events, the Be Healthy 100 Community Health Fair and our inaugural Maternity Health Summit. Both events are free to attend and designed to provide valuable resources, education, and support to improve health outcomes in our community. So stay tuned as we explore the details and hear from the passionate sisters driving these initiatives forward. So up first, we're going to talk about the health fair, and we have the Metropolitan Baton Rouge Health Committee Chair, Angela Norwood, joining us, and we also have Dr. Joynetta Bell Kelly. She is the director of the USDA Nutrition Hub and Nutrition and Health Outreach Specialist at Southern University Agriculture Research and Extension Center. So welcome, ladies. I'm so excited to talk to y'all today.
Thank you for having us. We're excited to be here.
So first, can you give me an overview of the Be Healthy 100 Community Health Fair and what inspired this initiative?
Well, the National Coalition of 100 Black Women, they have a health initiative that covers focusing on childhood obesity, cancer and health disparities, and metabolic syndrome. And so the health fair will focus on all these initiatives because at this health fair, well, last year, let me go back to last year. Last year, we had it at Greater King David. And we packed that place and we needed a bigger building. And so it was a great honor and privilege to collab with Southern University Ag Center and get this done at the F.G. Clark Activity Center to a bigger space because we were packed up in there. And we had to turn around vendors and couldn't accept vendors at one time because it just got so big. But right now we have at least 70 vendors coming to our event. And they're going to be focused on insurance. You're going to have insurance companies there. We're going to have people there that's focused on mental health, doing blood pressure checks, glucose checks. Also did I say mental health services? Mm-hmm. Also mental health services. And also we're going to have somebody showing you how to do hands-on CPR there at this event, which is great. So that's, so we're trying to impact the community because we know there's a need in our area on, health, taking care of ourselves, taking care of our body, and teaching our community how to advocate for themselves.
So what are some of the key highlights and activities happening at the Be Healthy 100 Community Health Fair? Can you share some exciting moments attendees can look forward to?
Well, first of all, I did forget to name some of our sponsors for this event. Let me name those sponsors. We have Bill Healthcare, who is going to be there sponsoring us. They focus on HIV, and they also going to have a photo booth there. We're excited about them coming. And we have Ochsner Health, and we also have Q106.5, who is also one of our great sponsors at this event. But this event, we're going to start off. We have a couple of things going on at this health fair. So we're going to do our Gentle with Our Mental series. I know last year we had it online, but this time we're going to do it in person. And we're going to cover, we're going to have Dr. Raven Dunlap, who's going to be covering youth mental health. And she's going to be breaking down the stigma of seeking help within the younger community. Since we're going to be on Southern University campus, we want to impact that demographic right there, because we know they're dealing with school, dealing with peer pressure, dealing with just outside things that's going on with college life. We're going to also have another panel saying Understanding Spiritual Mental Health with Dr. LaCrystal Johnson. And she's going to address misconceptions about mental health and spirituality and touching the topic of being church hurt. And then we're going to roll into Ms. Sheena Brown, a psych nurse practitioner for Women's Hospital, who will cover the understanding of maternal mental health and the challenges during and after pregnancy. experiencing high risk pregnancy, and discussing, going through losing a baby or a loved one after giving birth. And then after that, since we on mental health, we're gonna go right into our Black mental health panel, which is going to be a separate panel at a different time, and where we're going to hear stories from mothers who are going to share their experience from childbirth, um, things to look out for, how to advocate for themselves, what to look for. And we also going to have Senator Regina Barrow there, who's going to share her initiatives and policies in place to protect Black mothers. And then and with that being said, we also going to have a diaper drive. So we're giving out diapers to those first come, first serve, and wipes who come and register for something else that you'll hear later on in this podcast that's coming up. So come on out and enjoy us. But we're going to end that whole we're going to go into the nutrition hub with USDA nutrition hub, but we're going to end the whole health fair with jigger aerobics, which is going to be fun. We want you to bring your family, your kids, and come out there and exercise and get lit to get fit to be lit, and everything else. So come on out. So we're excited about that.
A lot of people were excited when we posted about jig aerobics. That's a very popular program. So they're going to be having a good time at the health fair.
Oh yes, it's gonna be fun. And then the first 200 people that come in, they do surveys. We have free food for them, free jambalaya. We're gonna have water, drinks, Coca-Cola, Cokes, tea. Everything is gonna be there, fruit. So just come on out and enjoy.
So how did the Southern University Agriculture Center partner with the National Coalition of 100 Black Women Metropolitan Baton Rouge chapter for this event? Who's gonna take this question?
Well, I could kind of start it off. Well, there was as I told you earlier, we needed a bigger venue. And then when I found out about the nutrition hub, which way it kind of correlates with our initiatives about advocating in the community. Well, just the stigma of I guess food desert. Am I saying it right, Dr. Kelly? Food and trying to find out what's going on in the community. So this will hit some of our initiatives and focuses in the community. And so we reached out to them. They say, yes, we will collab with you all. We love to partner and get this going.
Yeah, and Dr. Joynetta told me that they partner with several organizations and other people with initiatives to get their message out across the city. So the USDA Nutrition Hub is a key part of this initiative. Dr. Joynetta, can you explain its purpose and how it serves the community?
Sure, and thanks for having us again. And sometimes blessings come when we don't even realize that they're around the corner. We actually, during the freeze of programming and spending, we had an event planned, and it fell through because of the federal freeze on a lot of the spending that we could do. So this one came at the exact same time. So it was just a blessing that we still get to continue our message and our outreach and our impacts on communities. So the purpose, I'll just back up a little bit because this is a new concept. So this is the very first nutrition hub of the country. So it's right here at Southern University. It's right here in Baton Rouge. So there's a lot to be said about that. Now there are 3 other hubs around the country. One is in Texas, one other in Utah, and the other is in Hawaii. And the purpose of these, going back to the history of it, it started because the USDA wanted to learn more about food insecurity in places where communities are disproportionately impacted, by social determinants of health. And that's just a fancy way of saying where you eat, where you live, where you sleep, where you pray, who you love. Those are all things that have to do with how you can lead your life and the quality or the lack thereof of what you will have. So there was a listening session back in 2023. And members of the community in the Scotlandville area and in the North Baton Rouge area in general talked about how they were having different barriers and challenges in getting healthy food on their tables every night. So from that, the USDA listened and they formed a cooperative agreement with Southern University Ag Center to create um, interventions, activities, programming around fighting food insecurity. And so the main part of it is tackling food access. And you do that through education, you do that through partnerships, you do it through research innovation, improving access, as we all know, and through workforce development. And all of those areas, we've been working on and building all of those areas since I came on board last summer. So we are still in the beginning phases of building a program. We have our feet better stable on the ground now because we know the areas that we want to hit, which are which delve into feeding, growing, healing, advancing, and sustaining. And I'll get more into that, as time permits through this conversation. But we're really excited about bringing all those areas out and not just focusing on what's on the plate, but focusing on how it got there, where it's going after it leaves the plate, where the plate actually goes, what people have to go through to get it on the plate, what their lives are like to get to how they can get it on the plate. And just with a public health background and with being a lifelong public health servant, I've always centered myself on addressing health equity and food, and not just in food insecurities, but looking at the whole gamut of holistic wellness. And where I'm just happy to be able to bring that set of experience and those skills to this program. So we're really looking forward to bringing this out to the community and working with you all too.
So your job specifically as a nutrition health outreach specialist, what are the biggest challenges you encounter when promoting healthier lifestyles in underserved communities?
So we've heard it all before. It's access, especially in our community. It's the education part of it. Now there are different areas of marketing and socializing health. But what I have found is I feel like it's deeper. It's the root cause of all of that. And what I feel like is the root cause and what research points to is behavioral change. So a lot of times, folks can have resources handed to them. They might have resources they can pick up. We've seen it before. You can pick up a box of food. You have the best vegetables. You have the best nutritious resources. You have exercise. You have dietetic counseling and that sort of thing. But it's just like how people start at the new year with going to the gym and they're going full for about a week, and then it falls off. It's not because the resource was not necessarily there. It's because there is something in us. It's behavior, it's trauma, it's all types of adverse experiences that cause us to make the choices that we do make. Now, again, I'm not saying that it's not access, because it is also access. It is also access, but a lot of it does have to do with the choices that we actually make and the reasons why we don't choose to make healthy choices. So that's some of the biggest challenges that we have been coming across as we've been doing surveys around the state, and when I've been doing surveys across the country, when I worked with CDC and the U.S. Department of Health and Human Services. So, access is a big problem, but it's also behavioral change. And that's why we're looking forward to working with our School of Social Work and other mental health and behavioral health partners to help us understand why we actually do the things we do. A lot of it branches back from adverse childhood experiences. So we'll be working with child and family services departments to ensure that there's counseling, there are services available, and then the education part of it. Kids, whenever we go out into these settings, these health fairs, and I talk to kids about nutrition, and I talk about the food rainbow, and I talk about the 5 food groups, they get so excited about it. And they go home and say, look, I learned about this today. Let's go to the store and get this, or mommy, that's not healthy. My children do it all the time. And it's really interesting And it's encouraging to see that that generation who will be leading our generation in medicine, in science, in healthcare, in law, in everything that we have, that they have a hunger and a thirst for knowledge and for knowing what's good for them.
Now, I have a question. I heard you said, you can eat bad because of trauma. That's the first time I ever heard that in my life. But what if you're just tired? Like, who wants to cook? I don't.
Absolutely. Yeah. And I understand. And that's, it's a statistic out that says that the highest, and I'm gonna get this wrong, but I'm gonna get you the link to where it goes. But the population that eats the most junk food are upper middle class mothers. Because guess what? We are the busiest.
They
We
tired.
work, we take care of family. Children have to go to soccer games, rehearsals, all this kind of stuff. So who has time first to go to the grocery store, and who has time to come home and cook, and who has the energy to do any of that? So
Right.
what do we find? A drive through. So, that is true. It is, and that's all a part. That is a part of what we have. It's a part of what our village does and does not provide us at times. So it's it is still what we do now. That still branches back to behaviors, when you really think about it.
Mhm.
um, we have to get in the mindset of prepping ourselves. We know we're going to be tired Monday through Friday. What can we do to make sure that we are doing everything that we need to do to make sure we have nutritious meals for our family? How can we ensure that we get that moment, even if it's 10 minutes of time to decompress and to do something for ourselves in the day, like stretching or whatever? We have to we have to reprogram our behaviors, because I know sometimes my behavior is, if I'm feeling tired, first thing I'm gonna do is get a glass of wine and sit down. So that is still a choice that I made, right? So we have to get down to the bottom of, okay, this glass of wine is not going to change the fact that I don't have lunch in the morning and I'm going to be rushing. And then next thing you know, I'm going to be exhausted, too exhausted to do anything. So guess what? I'll probably be at Cane's, by the end of the day. So it all branches back to what we have to do to get ourselves ready, why we make the choices we make. And it's a lot that, a lot of layers to unpack with all of that. And that's just what it is. But we're really excited about learning those areas and seeing how we can tackle it.
So, are there any specific success stories that highlight the impact of your outreach efforts?
Absolutely. So, as I said before, we're really in the beginning stage of a lot of things. But one thing that I love is that through non-traditional approaches, which I'm building into the Nutrition Hub, we have come across partners who are, realizing that, hey, I might not deal directly with nutrition or exercise or health, but I can be a catalyst for change. For example, back in October, we had an event that was introducing the USDA Nutrition Hub to the Baton Rouge community. It was our kickoff. We had a lot of speakers there. We had a few speakers there from the government, CMS administrator from Region 6 office in Dallas, which covers also Louisiana. We had some local heroes there who talked about the things that they're doing, like Michael Veal with his the mushroom farm that was right back behind Scotlandville's library. Miss Pat LaDove, who talked about her family's commitment to ensuring that there are safer communities. We had a lot of Thomasina Joseph talking about the Clean Green Alliance. So that testimony, I call the testimonial phase. Those testimonies were great for people in the audience to hear, like, oh, okay, so I don't have to necessarily be in the realm necessarily of nutrition, of fruit, of farming, of animals. I can actually do something for myself. So there was one person in the audience who came up to me after the conversation, and he said, well, you know something, I own a car dealership. I don't really know how I can really get involved with nutrition, but I want to do it some kind of way. So what can we do? So we stood there and we thought about it. And I said, okay, you have a car dealership. So that means you have cars that you probably drive around and you let your folks drive around, and maybe even you're connected to a rental car situation. So he said, yeah, okay, where you going with this? And I said, well, when we have people who need food deliveries, why don't you enter into a memorandum of understanding with Lyft or with Uber or with, other institutions to deliver food to people who don't have access. So right now we know there's food insecurity in around the Scotlandville area, right? So if folks want some stuff, want food from Whole Foods or Sprouts or fresher options that are might be in Zachary or in other areas that are a little too far to access by public transportation or by buying, borrowing somebody's car, why don't you partner with them and commit a certain amount of hours to this issue by either letting somebody use the car or hiring or contracting with one of those car delivery services to deliver food to them. And he was like, I'm gonna do it tomorrow. I'm gonna set it up. So I think that one of the successes of this is bridging relationships and helping people to see that there are so many different non-traditional approaches that you can take to address a problem. It's more than one way to peel an orange or however you say it. And I think that the success of all of this is helping people to understand that it's more than one way to fight food insecurity, and there has to be more than one way to really delve down and get into the deep issues of why it is all happening.
So the day of the health fair, on the schedule is a USDA nutrition hub with the SU Ag Center. So what is taking place during that time at the health fair? Can I come get a bag of groceries and some eggs?
Well, actually, we don't actually have that. My portion of the nutrition hub does not necessarily have that, but we do have access to a lot of wonderful farmers, to a lot of people who will be donating. That is something we can definitely check on because we still have some time to see who we can actually get out there to have resources on hand. But the USDA Nutrition Hub, Malikian will be represented for us that day with our postdoc fellow Gabriela Rodriguez, and also potentially our USDA research liaison Teresa Crocker. They'll be there and they'll be talking about some of the strategy that we have behind what we're building. They'll also be there introducing passion fruit. One of the things that we are developing in our research lab is a passion fruit smoothie. And it contains a lot of active ingredients that actually go beyond protein, but it goes into health and holistic holistic health and wellness. So we'll be talking about that. She'll also be talking about workforce development.
Talk about the smoothies, or we could eat some of the smoothies.
There will be a taste test as well. There will
be. That's what I like.
And so what's interesting is Gabriella is she tested so far about 6 different flavors, and we got a chance at the Ag Center to test those out in the research lab. So some of the students around campus got a chance to taste it and talk about the texture, the appearance, the smell, and all that. So they're really fine-tuning their efforts. Another thing they're doing is researching diabetes and metabolic syndromes that make your waist get bigger. So we have waist circumference testing that she'll be doing, filling out questionnaires, ensuring that people understand the risks that come along with having fatty tissue disease. It'll be just a lot of information there for people to take with them and to bring back to their families. So we're very much looking forward to it. Oh, and the fun part about it, we have nutrition games and things for kids as well. So I'm really excited about that, and I know they'll represent us well. Unfortunately, I won't be able to be there, but I will definitely. This won't be the last time. So this is the beginning of a lot of great things. I'm looking forward to it.
Yeah, so we are excited with this partnership with the Southern Ag Center. And I'm excited to come taste some of that smoothie. And so, Angela, so are there any other resources that will be available at the health fair that we need to tell everyone about?
As she mentioned, was the nutrition hub, what she's giving out, and also the diaper and wipes giveaway. Definitely come out. And also, we're going to have the glucose reading, the blood pressure reading, some of the vendors are going to do that, and also some of the vendors are going to do, like I said earlier, do the hands-on CPR training. And so we have a lot going on. And as of right, last year we had HIV testing. So this year we possibly will not have the HIV testing, but we have the resources for you to go get testing.
Okay. And so if anybody wants to be a vendor, is it still room left or is it all taken up?
Well, we're almost pretty much closed. We have closed out, but still reach out to us at health@ncbw metrobr.org and email me, and I will definitely see and reach out to my lead, Tramika Butler, and see if we still have in the room left, because they have been coming in left and right. So we extended the time
And
of
somebody,
how long we were getting the vendors.
Sister Nina just sent a message saying also retail vendors. Are people going to be selling stuff there too?
Yes, they're going to be selling like nutrition items. Somebody is going to be there selling tea. Somebody's going to be there selling hair products. That's part of your health, also your skin and your hair. So some ladies are going to be there selling those products also. So that's going to be great. And also with candles, with relaxation, mental health, stress.
Yes. Well, that's exciting. So I put the flyer on the screen. You can register for free. And I guess vendor based on availability. So we hope to see you there joining us April 5th. And if you want to be a sponsor, reach out to the health committee at health@ncbwmetrobr.org. And so if anybody can't get involved this year, this is an annual event. You could definitely get involved next year too. All right?
Yes. It's getting bigger and bigger.
All right. Well, thank you so much, ladies, for being on tonight. So this is April 5th again. Registration is free, but in addition to the health fair, we have another big health event coming on. So thank you, Angela, and thank you, Dr. Joynetta, and I'll talk to y'all soon.
Thank you.
Thank you.
Okay, and so up next, we are bringing to the stage Nina Hunter. She's the public policy co-chair and a maternal health advocate. And Frankie Robinson, a nationally recognized leader in public health and the founder and president of the Amandala Group, LLC. And through public policy and advocacy, the Amandala Group works to eliminate systematic barriers and empower Black birthing people, addressing the social, structural, and political detriments of health. So thank you both for being on the show today. Let me take the health email off the screen. All right. So we are excited to talk about maternal health. Now let me be transparent. I've never been pregnant in my life. So if I have some crazy questions, don't be alarmed.
Bring it on.
But, this affects everybody.
Yes,
so first, tell me about the Maternal Health Summit on April 14th with our special guest, Judge Glenda Hatchett. Now, what inspired the launch of this event, Nina, and why is Judge Hatchett involved?
So, first of all, thank you for having me, Sister Shanice. Very, very excited about this event. This event is a partnership between the Public Policy Committee and the Health Committee of the National Coalition of Women of the Metro Black Village chapter. And having Judge Hatchett as our guest speaker is, I don't even know how to explain it. It's an amazing, amazing start to what we feel is an issue that we want to continue having a conversation about. And it's so compelling because it affects our community. It affects our families. It affects mothers. It's not just a maternal issue. It affects our entire community. So first off, Judge Hatchett is not only a world-renowned judge, but she's a prominent attorney that has over 40 years of experience. And many people may recognize her from TV, from having a national television show. but this is a judge of all judges. She is the first Black chief judge from the state of Atlanta in the state's history. She was appointed in 1990. So she's been doing this a long time. She presided over the Fulton County Juvenile Court, which is one of the largest juvenile court systems in the nation. She's also a civil rights attorney. She has worked on cases, wrongful death cases, such as Bobby Christina Brown's wrongful death lawsuit, where she won millions of dollars for that estate. She's also represented the Philando Castile family in civil litigation after his death. So when I say a powerhouse, dynamic mover and advocate in the world of maternal health, we are super, super excited to have her. And she has a personal narrative. She has a personal story. Judge Hatchett's daughter-in-law died within 24 hours of having her grandchild at a hospital, and had reported having maternal health issues over maybe about a 12-hour span. It was a situation where after the mother had a cesarean, she continued to have issues bleeding. The hospital did not adequately provide a standard of care, and the mother ended up dying very much soon afterwards. So, of course, after that, Judge Hatchett and her family sued the hospital and really dealt with issues relative to the standard of care. She dealt with issues regarding disparate treatment, which we'll get a chance to talk about tonight, and hopefully a little bit more at the summit. So maternal health is a community issue. It's a family issue. It deals with issues of disparate treatment. It deals with discrimination. And that's why it's important to all of us as a community and as a state and as a nation. And that's why, again, we're so excited to have conversations about it and bring it to the forefront. Ms. Frankie, who is with us tonight, is one of our distinguished panelists, and we're excited to have her. She's going to be at the summit as well, but she's local. She's right here in Baton Rouge and doing a lot of amazing work. And I know she's going to tell us more about that in a minute when we get a chance to speak to her. But additionally, one of our other panelists is Dr. Veronica Gillespie Bell. And she's a board certified obstetrician and a gynecologist and an associate professor at Ochsner Health in New Orleans, Louisiana. So we have experts, medical professionals, lawyers, doctors, and advocates all prepared to talk to us about maternal health, to talk about early warning signs, and to really make sure that when we walk away from the summit, we know what to do. We have next steps. We know what to look for. We know how to communicate to our medical professionals and to feel more comfortable talking about these issues. The other thing I'll just say that we're really excited about with the summit is that we have partnered with the Department of Health and Hospitals. I've reached out specifically to their nutrition program, which is WIC. And what we have been able to do to partner for this summit is that mothers, if you're a participant in the WIC program, you are required to go through certain trainings to receive information, to receive your WIC vouchers. And it's a part of the process of receiving assistance. And this program, of course, is tailored towards low-income moms or moms that are in need of assistance. What we've been able to do is to get them approval to attend the summit. And that will be counted as credit for one of the required trainings that they are required to do as a participant in that program. So what that's going to allow us to do is speak to the most vulnerable and the population in our local community and statewide that really need to know about these early warning signs and really need to know about how to advocate for themselves. Because, of course, when you're low income, a lot of times it's harder to get people to listen to you. And that, unfortunately, is just a characteristic of our community. So that is the summit. We're excited about it. And, of course, we're happy to have Sister Frankie. I'm calling her sister, but we're all sisters, right? Sister Frankie with us to champion this event and to help us get the needle moving. So thank you for joining us and accepting our invite.
Absolutely. It's an honor. Thank you.
And so Frankie Robinson will be one of the speakers at the Maternal Health Summit. And tell us about the Amandala Group, because you do this work every day. What is the mission, and how does it work to advance maternal health?
Sure, thank you. So the Amandla Group is a firm. I am a registered lobbyist. I'm an advocate. I'm also trained as a doula, and I really remain dedicated to community education. So through my firm, I offer direct lobbying services to clients, largely maternal health related social justice clients. I also provide project management services to various organizations and nonprofit groups, and I've done some consulting work with the Centers for Disease Control and ASHTO. I also through the Amandla Group and my doula firm, Black Joy, I engage in public education. One of those campaigns that I spearheaded was called Black Joy, and it talked about recognizing health warning signs, understanding common illnesses that impact moms while they're pregnant and disproportionately impacts Black moms and birthing people. So we talked about things like high blood pressure, other chronic diseases, mental health, some of the other additional contributing factors to maternal death and injury, just to make sure that as we as Black women and Black birthing people are seeing all of these statistics that are all over the media, that we understand what that means, because it's not enough to read Black women are 3 to 4 more times likely to die than our white counterparts, and just basically find ourselves being scared to death from numbers and just being left open to wonder, well, why? My public awareness conversations were about, what can you do? How do you advocate for yourself? What are these threats, and how are they threats to us? And what does this look like? And what does it mean when somebody says high blood pressure, right? And just unpacking those conversations. So I spent a lot of time at the legislature working with clients, passing laws related to equitable maternal care and preconception health. So that's just a little bit about what we do here at the Amandla Group.
So what initiatives or programs is your organization currently working on to improve maternal health outcomes for Black women?
Sure. So, we're on the eve of the legislative session here in Louisiana. At this time, I primarily lobby in Louisiana. I have lobbied in other states as well in previous years. But April 14th starts our legislative session here in Louisiana. And right now, the initiatives that I'm working heavily on are working with clients to shape public policy for moms. I mean, we all know that these times are very trying. They've always been trying, but they are exceptionally abnormal right now, what we're facing. Just a level of anti-Black sentiments and anti-Black policies that are being pushed at the national and state level. All of those things, even when they're not policies that scream maternal health, where you literally need to read the words hospital or medical provider or doula or high blood pressure. If you hear things like, low pay wages, jailing children at 14, these are all things that we know impact our overall health because of the chronic constant stress and pressure that does things like disrupts our hormonal system, which then disrupts our cardiovascular system. So we have a lot of touch points that truly impact our overall maternal well-being that aren't necessarily things that are glaringly saying maternal health. So that's where we are focused right now. Additionally, I do also have other initiatives such as community events. I actually have an event tomorrow where I'm hosting with partners an advocacy training to arm people with the knowledge and skills, no matter where you are on the spectrum, a newbie, pro, and wherever it is you are in your advocacy public policy making journey, there is something for you. And we're going to talk about how to navigate the state legislature, how to advocate locally, how to understand what's happening at the federal landscape, understanding the duties and powers of the executive branch of government versus the legislative branch, how to navigate Congress. And then we're going to have some practical examples of some real life powerhouse advocates who are doing a plethora of things to really bring about change. And then on Saturday, an example of community education, I am hosting Roots of Sacred Resistance, and it is paying tribute to the Black grand midwives who were literally trying to be or were trying to have their profession taken to modern day structural medicine and capitalism. So we're giving honor to those wonderful, extraordinary birth workers who were literally doing it all, and talking about where we stand present day at the midwifery program and access to midwifery and equitable midwifery representation, such as our Black midwives, and just talking through current public policy implications and things that we can do to make that model of care more equitable for Black women and for women overall. And then we're also, because it's a heavy topic, we have healing practitioners who are going to be there to take us through that journey, and we're going to view a documentary. So those are just some of the examples of some of the things that we're working on.
What is the difference between a midwife and a doula?
That is such a great question and such a common question, and I'm happy to answer that. So few key things. So one, a midwife is a medical professional. A midwife, under their scope of practice, can deliver a baby, or in midwifery terms, catch a baby. And they are medical professionals. They deliver, right? They can do home deliveries depending on their licensing. They can deliver at hospitals. They can deliver in freestanding birthing centers. You can have a midwife on a team with a medical professional, and midwives typically support births that are considered low risk, right? That are less risk of needing a surgical intervention. A doula is a birth coach, right? And for regular terms, they are not, or we are not medical professionals. We are members of a support team for that birthing person. So we're going to do things like provide education to that birthing person, because we know when we go to a doctor's appointment, the little bit of time you have there, sometimes you leave with more questions than you had going in, and then your appointment's over. But if you've got your doula that you selected, that is your constant, after that appointment, you can go sit in the lobby or go have coffee or go back home or just converse somewhere, and they can help you digest that information, the medical jargon that your doctor shared with you. They can help you with comfort techniques. They can really help you with managing your stress levels, refer you to resources, and do most of the things that are really filling in the gaps with that medical provider with the time and effort they're able to, or even willing to sometimes, to provide. So we are not delivering babies. We're a part of that team with a midwife and or an OBGYN or an OB. And we are there in the postpartum period to support that mom and that family in that transition. And we're there at the entire birth to help give that mom comfort measures, to help support them in their advocacy, their self-advocacy, and just being also an extra set of eyes and ears to really stand up for that person and make sure that the various protocols are being followed. We are there to comfort them, not to deliver the baby.
So this is still an extra question from me. So when you have a baby at home, or like on TV, I see them have it in the bathtub. Like, which one does that, the midwife or a doula?
Great question. So the midwife is doing that because, again, the midwife is there to guide through the birthing assistant, the birthing experience. They are that medical professional, right? So instead of a doctor, that midwife is there to deliver that baby, take care of that baby, transition that baby, do that initial checkup for that baby, make sure the baby's okay. And the doula, I may be standing there at the mom's shoulders, coaching her through breathing exercises, letting her know, assuring her that everything is going to be okay. Go check on dad while he's passed out on the floor, whatever the case is. And be that comfort.
To have your baby at home, you have to have money. Is this something like a low income person wouldn't be able to afford, to have it all set up at home?
Yes, the home births. So basically, and you've caught me where I need a refresher actually about
No,
the
I'm sorry.
different types of, no, you're fine. Thank you. Keep me on my toes. The medical coverage is available for home births. That I can't speak to right now because you caught me off guard. So I'm sorry, but I can get that answer for you for viewers who are interested, because there's different landscapes. What Medicaid will pay for and what it won't. So when you say low income births, so if someone is covered through Medicaid, I need to refresh myself on that coverage spectrum. But yeah, I will get back to
And
you
I
on
just
that.
asked that because I've only seen people have babies at home on TV. Like, I don't know anybody personal in Baton Rouge had that baby in the bathtub.
Well, and see, and I'm so happy you brought that. So two separate things too. So let me say this. So literally home is one thing, but yes, there are Medicaid plans that will cover birthing center experiences. And guess what? Birthing centers have bathtubs, a freestanding birthing center. So yes, they it's supposed to mimic the feel of home. Like, you literally, in many cases, while you're giving birth, you're in a bedroom type setting. Like, it looks like you're at home. And with the births that I have accompanied birthing people on, the rooms that we were in, you can navigate from the bathtub if your midwife says that's fine. They've gone back and forth through the bed, and you can give that yes. So someone who is, as you mentioned, low income, yes, that is an option. There was an advertisement earlier this week that Baby Catcher Birthing Center in Lafayette is now accepting Medicaid insurance, 2 plans. And to find out that the insurance scope has broadened, to know that the opportunity that you just described, that every birthing person deserves if they want it, is available to more moms despite income inequities, was very exciting, because we all deserve a joyful, dignified birth of our choice, no matter what our economic status is. And sadly, that is not what we're seeing. And that also is what fuels me every day to do the work that I do, because it should not be a privilege to have a joyful, safe, equitable, honorable, respectable experience, but it is a privilege.
So why are you both so passionate about maternal health? Is it due to personal experiences?
So I'll go ahead and just chime in there, because I guess I technically would call myself new to the arena of just having an opportunity to get involved and to perform and speak about advocacy and make the connection to maternal health. I have 2 children. I have a son who's 10 years old and a daughter that is 6. And I'm a single mom. So at the time when I had my daughter, I was a licensed practicing attorney. I still am a licensed practicing attorney, but I was unemployed. So I was not working for a state agency where I had spent most of the time with my career. So the reason I bring that up is because I was a Louisiana Medicaid recipient. And so I didn't have the benefit of my own, health care professional through my state covered insurance plan. I had to get what you're offered with Louisiana Medicaid. And so with that experience, you saw, multiple doctors, multiple professionals on your visit. So that's one of the first issues, is continuity of care. So if you had an issue, you spilled your guts to a professional about everything that was happening. The next time you went to that doctor, within that period of when you were allowed to see a doctor, you could talk to somebody else totally different. And they would not have read it, and they do not know. And you have to start all over again. So if you had an issue or a complication, you literally have to be prepared to tell that story all the way over again from the beginning. It's 9 months, okay, of receiving this type of care. So to get to the point of it, when I got ready to have my daughter, Jada, it was a natural birth. That was a good thing. And I didn't really have a lot of complications prior to the birth, other than the fact that I did have a miscarriage. Jada was actually a twin. And I didn't know I was pregnant with Jada until I miscarried. So I had been going to the doctor for 3 months. And at no time when they did the ultrasound did they notice that there were 2 babies. So when I went to confirm that I had a miscarriage, and I had physical proof, I won't share, but I had physical proof that I had a miscarriage. I went to the doctor to confirm that pregnancy was canceled and the baby was still in there. And that's how I knew I had 2 babies. But the doctor never told me that. It never came up in the ultrasound. So the rest of the pregnancy went normal. I went in to delivered the pregnancy. I delivered Jada, healthy, 8-pound, 1-ounce baby girl. But I wouldn't stop bleeding. And so I'm bleeding. And I recall one of the nurses coming in afterwards to check my wounds. And she literally said this: "It's too much." She said that while I'm sitting there looking at her like, "Ma'am, help me," right? She said that. So of course I'm starting to panic. I know something is wrong. And there's blood all over the floor. At some point, a supervisor or something comes in, and I'm not going to name the healthcare facility, but a lot of the facilities use students. It's a training opportunity. So you have a lot of students in the room. So at some point, a supervisor comes in and she's teaching the students about how they should have properly pushed on my stomach to make sure everything was out. That's probably like the most important part of the pregnancy, because if you don't get everything out after that baby comes out, your uterus is not going to close and you're going to keep bleeding. And that's what happened to me. So I had blood clots, and I could feel the blood clots because they were excruciating. And I could tell when they were coming. And the lady or the nurse who was trying to assist me, I mean, it was more painful than the contractions, the blood clots were. And so we knew something was wrong. It was like, we're gonna do a procedure, right? And this is how it was described to me. They're gonna put a balloon inside of you and they're gonna fill it with water, right? And whatever that process was, I never learned the medical term. They're gonna slowly let the water out over time, over the next day, and hopefully it will help my uterus contract back like it's supposed to and stop the bleeding. So at this time, it was just me, my daughter's father there, because my family hadn't made it to the hospital yet, and there were a lot of other things going on. So at that time, it was just me and my son and my daughter's father. And so they reeled me out to go in the procedure. They went to put me out. And that was when I had a panic attack. And I had a panic attack on the bed in the hospital operating room because the students who were trying to prepare me didn't know how to set the stirrups up. And they were talking about it. And they were laughing about it. And they were like, where does this go? And just random. I am terrified, okay? Because one, I'm bleeding. I just left my daughter in the room with her father. He looked terrified. And the people who are about to take me, and I'm terrified of anesthesia. All of this is going on. Tears are coming down my face. And the anesthesiologist, you know what I'm trying to say, anesthesiologist, who's next to me, notices finally the tears wailing and pouring down my face, but I can't speak. I'm that terrified. I'm full-blown panic attack. And the only word I was able to get out is panic. And that's when he shot me with whatever the medicine was to put me out. So when I woke up, my entire family was in the room. I remember that. And the day my daughter was born was actually the same day of my dad's birthday. So everybody had been gathering to try to multitask, trying to celebrate birthdays and then my daughter's birthday. Well, that birthday party got canceled. And when I got back, when I came to, my entire family was in the room. And I know now more than ever how significant that was, because hospital professionals are not going to listen to you if you're alone. And if you're in pain, it can be brushed off. And those symptoms that you're experiencing, that you're trying to communicate with, and that we're going to be talking about, especially more at the summit, they can be dismissed because they look like ordinary symptoms. But when you're pregnant or when you're after you had a baby, there's no ordinary. Everything is important. Everything is and so afterwards, I think they may have been kind of concerned with everything that was going on. They knew I had a panic attack. They gave me some medicine to calm me down. Well, I had a reaction to the medicine. And so at that point, my family is in the room And the medicine was so strong, it was like it was trying to make me go to sleep, but I wasn't ready to go to sleep. So my eyes were bulging out of my head, and I was just delirious and speaking. So my family got to witness this. And so long and short of it, I lost so much blood, I needed a blood transfusion. I did not want it, because who wants someone else's blood, right? You don't want that. And I had been in the hospital 2 days. I was in the hospital a total of 4 days. And the way they got me to get the blood transfusion, once they move you out of that room that you deliver, and they put you in this little bitty tiny room that's like a bath. It's not very comfortable at all. And I couldn't feed my baby. I wanted to breastfeed. I lost so much blood, I couldn't even make milk. And so my baby is restless. They're giving her formula when I didn't want her to have formula. And they're trying to convince me to have a blood transfusion that I didn't want. And so the way they got me to get it was, they said, if you get this blood transfusion, we'll let you go home. And that's why I did it, because I wanted to get out of the hospital. I had been there 4 days. And you're on Medicaid. After that baby's born, that Medicaid is only going so far. At some point, somebody's not getting paid. All right, and that's how it works. So I got the blood transfusion. I went home. I bled for 6 months. I was weak. I couldn't walk from one side of the Walmart to the next. I could barely care for my daughter. I needed assistance because I couldn't do anything but literally lay in bed because I had lost so much blood. And it took that much time for me to recover. And thank God, I really don't know how, because I wasn't working. I was an attorney with no job. But I made it through that. And so that's just the main thing was Jada. And after hearing other stories and seeing how moms actually did bleed to death, and knowing that could have been me, and knowing that, wow, I was a Medicaid recipient, and how many other Medicaid recipients who don't have this platform, don't have this voice, not educated, have the ability to communicate about it, and and let it be effective, to cross the way the ways that it needs to get to the people that need to hear it. And so that's why I'm really, really passionate about this. And that's why when I got an opportunity to partner with Health to do it, I couldn't help it. And when I got a chance to reach out to Ms. Frankie and see all of the work that she's been doing, and to see all the stuff that Judge Hatchett has been doing, it's been an honor for me to just be a part of it and to continue to have the conversation, because I definitely experienced it. And I just feel like any other mother anywhere, you would think you would know. Oh, she gonna know. She see this. You're not gonna know. You're not gonna know. No matter how many degrees you have, you don't know. And you need people in the room who are knowledgeable. You need that extra mother, cousin, sister, brother, anybody to go to the doctor with you, and to continue having those conversations. And quite honestly, to be that nerve-wracking, unknown family member that you're afraid of sometimes, because they can really save your life, especially if that medical professional or that doctor doesn't believe you and they're not listening.
I think those are some really excellent points. And thank you for being so vulnerable to share your story. As someone who shares my premature birth experience, I know that for a lot of people, when you dig deep and recall these experiences, it's traumatic, whether we realize it or not. And every time we relive these experiences, we're unearthing trauma. So I've learned from experience that, and I didn't really recognize that as I listened to women share their experiences prior to me having my own. So I'm thankful for you and trusting us with your experience, because I mean it was a terrible journey that you have just described, and I'm thankful that you're here to tell your story. I'm sorry for your loss. And I'm grateful that your baby girl is with us, and I'm just grateful for your advocacy so other moms don't have to experience what you did, because there's so many protocols there that were just not in accordance with what things should be. And you mentioned about an advocate. Some people, of course, don't have that village, and especially when instances like that, that's where a doula could be a lifesaver, to be that person there. And even for someone who does have family-based or partner-based spouse to be supportive, they may not have that birthing medical background. So having someone knowledgeable in the birthing community, like a birth worker, a doula, community healthcare worker, is so essential, because they can be there to call out instances like that are abnormal, work with your spouse to help advocate and comfort you as you're crying because you're being disrespected and basically dismissed from your own birthing experience in your room. As your doula, I would be there comforting you and your partner, who I know had to have been deeply as hurt as you, and seeing what you had to endure. So I am an advocate for doulas all day long, because as doulas, they can support in filling in that gap in instances like that to help birthing mothers who are experiencing this, or help try to prevent it as well.
And Frankie, before you get into your story, Nina, I don't know if you saw in the private chat, Dr. Joynetta, who was on the first segment, she said, Nina, your life is a testimony. I worked in maternal health in NYC and would love to partner with you. Please email or call me. And so she put her email and phone number in there.
Absolutely.
So we making connections. Come on.
Yes.
And I appreciate what you just said, Ms. Frankie. I didn't have a lot of understanding of what doulas did back then. Like my son, Jada is 6 now, but just hearing what you said about doulas and incorporating, that to my experience and then others, I see now how, just, pivotal it is to have, everybody should have access to doulas because of those very things, and especially with vulnerable families who don't have those support members there to be in the room. Even more so now, I see it from just hearing and understanding more about what doulas actually do.
Yeah, I really wasn't familiar much with the role of doulas a decade ago. This is something that really has picked up more momentum in terms of the role in doulas in reducing maternal health poor outcomes. And I saw one of the questions that was in the chat about, is there research about how doulas are pivotal in that? Yes, there's tons of research out there that has shown that doulas can help reduce maternal mortality, and doulas can also help reduce preterm birth, which is birth of babies before 37 weeks gestation. And doulas can also help reduce unnecessary cesarean sections, which is a major problem in our state. More than a third of our births are welcomed or initiated by cesarean section. And we know that they're not all medically necessary to subject a mom to major abdominal surgery that will require more recovery time, potentially risk for infection and other things, is just really irresponsible. But that is a problem that we still have in our state. It's really a problem across the nation, but Louisiana has one of the highest C-section utilization rates, and also one of the highest with racial disparities. More Black women are being given C-sections, and more women who are insured by Medicaid are being given C-sections, and that is problematic. I think with medical professionals, of course, there are certain health risks that prompt C-sections, medical emergencies. So in those instances, that's merited. But studies have also shown more C-sections happen after 5, more C-sections happen on Friday, and literally have just community members who've come and shared that I know the doctor wants to do this out of convenience. So we have to continue to self-advocate and tackle those things. A lot of times, things like gestational diabetes, maybe prevalent in some birthing people in their experiences. And you can have a doctor says, oh, your baby might be big. Well, let's educate on that. Like big babies, they were all time, that doesn't necessarily mean you're going to need a C-section, right? So just really, and that's why I'm really big on self-advocacy and education, not just advocating the birthing person, but that whole network, right? That touch point. Because then also you have times where you have the person who's pregnant, they may start to present with certain illnesses. So if that person's spouse or partner or sister or mom see some changes and they're like, wait, is this a blood pressure issue? Could this be preeclampsia? Because sometimes you're so busy, you don't notice these changes in yourself. I mean, even for me, when I was pregnant with my second child, my daughter, I was literally sitting working. Speaking of Medicaid, I was typing up some Medicaid testimony for lobbying in Mississippi. And I was just realizing I was just feeling really off and I was stressed. And I was like, I need to go see my doctor. And I stopped and I called and I walked in. I had a blood pressure 160 over 100. That was like delivery territory. And, so sometimes we don't realize that we're so busy just doing all the things and trying to survive. And we could literally have a medical emergency that's there and not know it, that could take us out, that could injure us, and in many instances can snatch the life of our babies in utero as well, because hypertensive disorders can lead to things like stillbirth and other needs for early deliveries. And if the baby is not ready to be born and can't sustain life on its own, it could result in an infant death. So there's just so much to be done, but it starts with self-educating and self-advocacy, holding the medical community accountable. And then also just, with the medical community, just reversing where we are. Birthing is not a drive-through experience, right? People need to be able to take time with us. We already know the cutbacks, like from years before with insurance, you have so many days you're in the hospital. And then we know now, like some of the leading causes of death after birth are, some of the leading causes of maternal mortality are in the postpartum period. So it's in the months and up to a year after birth. You've got mental health disorders untreated, and then the coincidences with substance use disorder and lack of resources, understanding. You have intimate partner violence. There are a plethora of things, but a lot of these deaths and occurrences are happening in the postpartum period, right? So education is big, resources big, having time off work, paid time off work, support your family, mental health access, support. Postpartum depression is a real thing. I dealt with postpartum anxiety after just going through the trauma of preemie birth, right? That ending of my pregnancy abruptly and bringing a preemie into this world at 28 weeks and 2-month hospitalization and recovering from high blood pressure and just really the stress of that, having a 2.5-year-old at the time. My kids are 6 and 7 and 9 now. So, and just really understanding mental health and understanding how things present, because some of these things, I'm not gonna say they're normal, but they can be fairly typical. And there's resources to address anxiety, postpartum depression, postpartum anxiety, PTSD, relative to things that present for pregnant and postpartum moms. But we have to recognize and then seek treatment and resources if they're available. And in instances like me, from my advocacy hat and not my survivor hat of, postpartum anxiety, from my advocacy lobbying hat is advocate for better resources and ending of inequities for Black birthing persons, which in essence will make birthing experiences better for all women, right? All birthing people.
We had a question in the audience about doula certification. How do you go about doing that? Do you teach that?
No, I'm not a doula instructor, but I've gone through 2 doula trainings myself. One of my favorite doula trainers is Nicole Deggans. She's with Sister Midwife Productions, and she's an international doula trainer. If you visit, I believe it's sistermidwifeproductions.com or Sister Midwife Productions, you can sign up to take one of her in-person doula classes. And the in-person classes, I think, would be like a week or a week and a half. It's definitely very very intensive, informative experience. And it is not some sort of, fly by night experience. Doula is a real profession, and we have real training, and we have our own unique things and characteristics that we bring to the birthing team. The doctor has their job, the midwife has their job, doulas have their job, lactation specialist has their job. So there is some real in-depth training involved, about a week and a half. And I also trained with Dona International, and that training for me was about a week.
Okay, so why is maternal health a community issue and not just important for new or recent mothers?
Yeah, so that's such a great question because, just like anything, especially like child rearing, you say it takes a village. I mean, we have to be so much more connected as a society with our level of awareness because we're interconnected, whether we know it or not. We're interconnected on race, we're interconnected on socioeconomic status, we're interconnected on sex and gender, and we're interconnected as a community. And one of the things that I mentioned before was about some of the contributing factors to adverse maternal outcomes. And one of the things that is very prevalent for Black women, Black birthing people, is this thing called gendered racism. It's the intersection between racism and gender. And one of my favorite researchers, who's a mentor to me, an amazing woman, her name is Dr. Fleta Mask Jackson, and she's in Georgia, in Atlanta, and she has conducted research on this very topic. So I'll use that as an example. How is this a community issue? When we read about experience, learn about maternal mortality crisis, which affects all women and birthing people, but we look at the disproportionate impact it has on Black birthing people, and we look at some of the contributing factors, societal stressors, social determinants of health, all of those things impact us. And those aren't things that we're experiencing in a bubble. They are societal based. Gender and pay inequality, racial inequalities, police violence, just everyday anti-Blackness, educational opportunities, transportation, access to healthcare, the lived experiences of our family members, racism, all of those things. How, like, we know with social determinants of health that basically the premise is that 70% of our health is indicative of society around us, and 30% is other. That's just one example of how it's all interconnected. So this doesn't become a mom's problem, a Black mom's problem. This becomes all of our problems. It's all of our problems when the employer does not pay a living wage. It's all of our problem when we don't have access to healthcare. It's all of our problems when the jobs are not paying and providing insurance. It's all of our problem when jobs pay just a little bit so that you don't have insurance, right? And that you are seeking public insurance because they found ways to cut corner. It's all of our problems when the criminal justice system is feeding the school to prison pipeline. Those are all things that are impacting our health. And we can just keep naming the inequity. So this becomes a societal problem that is on our shoulders that we all take onus for creating better outcomes, because the inequities don't have to be there, but they are.
And our president is asking a question: what can the 100 Black women do to continue to raise awareness and advocate for better maternal health?
I think continuing doing what you're doing, coalition conversations, spreading awareness, the educational piece. First, we have to know our rights. Well, not necessarily in particular order. We need to know our rights. We need to also know how to advocate for ourselves. We need to know what are proper protocols, what aren't. And I mean, in the hospital setting, outside of the hospital setting, we need to know, what our laws are. For example, we have the Pump Act, and we have various laws that have been passed in our state that indicate that your employer needs to provide reasonable accommodations after you've had a baby or while you're pregnant, right, to meet your needs, whether it's a break, a dedicated space to pump or breastfeed that's not a bathroom. Understanding what those rights are so to make sure that you are receiving what you should be receiving and treated the way that you should be treated. So that is certainly a charge that the 100 Black women can make sure that this information is provided to not only members, but the community. And then from a policy perspective, being an advocate, I welcome support with the advocacy work that I am working on in conjunction with and on behalf of my clients. And largely it's centered around maternal health and clearly Black maternal health. I can share information with the chapter about upcoming Advocacy Day that I'm hosting for several of my clients who are known as Mama Plus, the Mama Plus Health Coalition. And we do that during Black Maternal Health Week, which is April 11th through the 17th. Many people know we're hosting it on the steps of the Capitol April 16th. And I can share with leadership how to sign up through our Eventbrite. And we would love to show strength in numbers to really have our voices heard. And we can look out for one another because it takes a village. There may be people who say, you know what, going to the Capitol is not for me. That's not my ministry. I'm not built for that. Look, in this political climate, I can understand that. There's enough things to go around. We go in the voting booth and vote. We make some donations. We support candidates. Your ministry may not be at the Capitol, but we all have to do something. Your ministry may be going to visit that postpartum mom and changing the narrative that, oh, let me go see the baby. No, go see the mom. Let that mom rest. Let that mom who's bleeding for weeks, right, get some rest and take care of herself. Check in, start a meal train, check on that partner, right? Maybe it's changing the culture of how we treat moms in terms of being invisible, right? And rewriting the narrative of what postpartum healing and recovery looks like, rewriting what mental health understanding looks like, removing the stigma, reshaping how we address or view people when they're having a mental health crisis, right? Maybe it's that. So I think that there's a lot that we can continue to do to really uplift ourselves and support ourselves, because honestly, a lot of times we're all we got. And right now in this political climate, we got to help each other. So, yeah.
So we kind of went over, but it was so good. I didn't want to cut anybody off, but I do want to bring it back to the Maternal Health Summit. Make sure you register. This is a free event and it's virtual, so you don't even have to leave your house. And as we said, Frankie will be one of the speakers, and we have, I can't read her name. What's her name at the bottom, Nina?
Dr. Gillespie Bell. Yes, yeah. She's amazing.
Yeah. So we are so excited about this. Is our inaugural Maternal Health Summit. So we haven't really done work in our chapter locally. So this is our, stepping our foot into it. And so we know this is going to be a success. And we're also adding the element of maternal health at the health fair. So we definitely hope to partner with you on more things. And this is an important issue. Again, even though I'm not a mom, you have taught me how this is important to everybody, because my friends that are moms, I don't want them to die having a baby.
Absolutely.
And we want them to be joyful, right?
Yeah. And when you go to the doctor, how you can speak up for them. That's the other part of how it's a everybody issue, because moms are not going to always be able to advocate for themselves. It's going to be that friend. It's going to be that sister. It's going to be whoever that person is that decided to go to the doctor with them that day, or who decided to go to the hospital with them that day. I think that's another, big takeaway. Moms shouldn't be going to the doctor by themselves. If you know someone that's pregnant that's going to the doctor and she's just like, oh, it's not going to be that big, go with her and listen to what that nurse is saying and ask questions and find out about the chain of command in that hospital. Find out about just find out, who that supervisor is and who that extra nurse, who that attending is, and all of those questions, because when it gets down to it, the key to advocacy is making sure everybody in the room is comfortable speaking up and asking questions.
I echo that. Absolutely.
Yeah. Well, thank you, ladies, for being on the show tonight. This was a good show, and it was all connected, because the maternal health goes with nutrition, goes with mental health. Like we were talking about all kind of things that connect, just to have the total health from head to toe in all ways. And so we want to advocate for our community to be healthy in several ways. So thank you, ladies, and we definitely be tuned in to the Maternal Health Summit because this was like the precursor. So now we know it's going to be good.
Yes. Yes.
All right. Thank you.
Thank
And the president is saying, good job, ladies. Can't wait till next Sunday. Somebody's saying, what a show tonight. We getting rave reviews.
Awesome.
So thank you. Awesome show. And somebody else saying, great. I learned some good info. So this was great. So thank you again for coming to the show.
Thank you.
Thank you.
Good night.
Good night. And so make sure you register for our health fair and our Maternal Health Summit. Both are free. And thank you to my guests tonight, Angela Norwood, Dr. Joynetta Bell Kelly, Nina Hunter, and Frankie Robinson for being my guests on the show and for all the phenomenal work you all are doing in the community. To stay up to date with everything we are doing in the Metropolitan Baton Rouge chapter, visit our website at ncbwmetrobr.org. And there, if you want to support our programs, you can go to the donation tab and give us a donation. You can specifically pick Health Committee if you want to donate specifically to the Health Committee to support our programs. I've been your host this evening, Shanice Lewis, on behalf of the Metropolitan Baton Rouge chapter and President Courtney Hunt. Thank you for tuning in to Keeping It 100 Coalition Conversations. And until next time, God bless.